आज हम बात करेंगे स्लिप डिस्क ऑल्सो कॉल्ड द डिस्क हर्निएशन, इसके कुछ कॉजेज, सिम्टम्स और ट्रीटमेंट्स के बारे में। तो बेसिकली ये होता क्या है? दिस इज बेसिकली व्हेन द इनर जेल ऑल्सो कॉल्ड द न्यूक्लियस पल्पोसस इट पुशेस आउट थ्रू द आउटर लेयर एंड compresses the nerve root. So some of the very common causes are basically when the core muscles are very weak, and also sudden twisting movement, and it's also because of the degeneration, and heavy weightlifting also causes this, and prolonged sitting or flexion. अब हम बात करेंगे कि very common symptoms जो होते हैं in disc bulge or disc herniation. इसमें जो है वो basically lower back pain is the main symptom, and also it radiates. So radiation with low back pain, and also numbness or tingling, and also the pain increases when you bend. And also with cuffing or straining, it increases. Muscle weakness is also a very common symptom in this condition, and it relieves when you extend. So as I mentioned in my previous video, the McKenzie extension, this is when the disc is involved, it causes relief. So इसमें कुछ टेस्ट परफॉर्म किए जाते हैं, like how do we know if the disc is involved? इसमें जो है वो 3 मेन बेसिकली टेस्ट परफॉर्म किए जाते हैं: SLR, crossed SLR and slump test. अब हम आते हैं इसकी ट्रीटमेंट की तरफ, जो कि बेसिकली हम फेजेस के अकॉर्डिंग देते हैं पेशेंट को. सो बेसिकली एक्यूट, सब एक्यूट एंड रिहैब फेज. So in acute phase, because the condition is new, you can call it in simple words, we have to mainly focus on the pain control, which we can do by TENS, cryo or heat therapy depending upon the irritability, and also postural control and education of the patient to avoid bending or forward flexion. In subacute, you can perform activities like nerve gliding, pelvic tilt, hamstring stretch, and also McKenzie extension exercise. And last but not the least is the rehab phase, which is also the strengthening phase. So you can perform the core strengthening exercises and also the overall strengthening exercises of the lower limb as well, since the pain is radiating down to the leg.